Hello, everybody. We are here on episode 7. We're going to talk about some fun things today with some of our specialty lasers and treatments. The first one that we're going to talk about is the Profound. We have Amy here. That's our nurse practitioner. Amy, how long have you been with us?
It'll be going on 3 years in January.
So she's amazing, has done an amazing job. And we also have Shawna. Shawna, how long have you been here?
A little over a year.
A little over a year. They are like the perfect team. They work very well with each other. So on this episode, let's talk about some of the lasers that we do in some of the areas that it can treat, starting with the Profound. Profound is one of our new lasers. We're really excited about it. It treats a lot of different areas, but it really focuses on the areas that people don't like the most. It seems like in the neck, there's a lot of elasticity that's lost and volume loss and everything like that. So it really helps with that tightening. And what does that usually what? Like it's a one treatment type thing or?
Yeah, it is one treatment. It's supposed to last up to 10 years. So really you would only need one, maybe two in the future, but not very many like your other lasers that you have to repeat often.
And it also treats the legs, correct? Like in the saddlebag area?
Inner thighs, outer thighs, knees.
So
neck.
when somebody comes in, what is something that they could expect? Like, what's the process with them? Like they'd come in and then they would have like numbing or like what is the process normally with that?
During the procedure? Yes, topical numbing. Prior to, we have them take something to relax them, medication according to what they would need. We can use our Pronox, which is our nitrous gas to help them relax. So we get all of that going, and once they're comfortable, we start topically numbing, and then inject numbing, and then we go straight into the
So
laser.
they're just numb.
They're numb.
They're good to go.
Yeah.
I've had my legs done. So, and Shawna did my legs. And I would say that with all of the steps involved for that procedure, I was comfortable. When we first started, we were like, okay, well, let's see if we really do need the Pronox, or let's see if we really do need that. And so, anytime we bring on anything new, we always test it ourselves because we want to make sure, A, does it work? Do we like it well enough to even provide it for our clients? Because if we don't love it, how do we expect anyone else to love it? And then what to prepare for them to where they are at their most comfortable to get also that most optimal result. I did notice after my legs that, because the first thing everybody wants to know is what's the downtime? Like if I have this done, what's the downtime? What are my restrictions and all of that stuff? And I would say for me, the first day was soreness, like uncomfortable, almost like a bruise. And then second, third day, it just started to get better and better. So I think people that are a little fearful of just like, oh my gosh, I just don't want to be out for a week or 2 weeks or anything like that. I didn't experience anything like that at all. And it didn't seem like anyone else that has had it done since then has as well.
Right.
And would you say that the legs or the face would be more intense with treatment? Like
They're about the
process
same.
about the same?
Yeah, people handle them the same.
Okay.
The legs take a little bit longer because it's more area. The face is super easy, quick. They'll just have some bruising, tracking, a little bit of swelling in areas, but after about 7 days, they're good. I mean, like it's all cleared up.
And on the face, what part of the face does it usually?
It's like the beard area.
Okay.
So it starts up by the
So
ears.
right up through here.
Tracks down around the mouth. We can get these folds right here. And then we go under the neck just a little bit right here. And get that fat pad right there.
Right, get that area that no one really likes.
right.
You know, like. So there's another laser that's a popular laser, the CO2 micro laser peels and things like that. There is a little bit more downtime with that, wouldn't you say?
There is. You're looking at approximately 10 to 14 day downtime after receiving that treatment because you have a lot of swelling. You almost kind of look like a burn victim patient.
Yeah, right.
So patients don't often want to go out in public when they look like that.
So you would say somebody booking for a CO2, then that is like the major treatment, right?
Resurfacing.
That's the one
The
where
big daddy.
everybody's like, I need to end up doing that one day, and if you do micro laser peels and everything like that, it does a really good job and everything, but to really get that deep penetration, it would be the CO2.
Yes.
And it seems to be like, if they were to take off work or whatever, it's usually like, take off for like a week. And then
Correct.
after that, you should be able to put your makeup on and everything like that. Is there any ways to shorten that downtime?
There is ways to shorten the downtime. You can look at putting growth factors applied after the procedure with what we call exosomes. They are growth factors to speed up healing, reduce the inflammation. So they're just going to optimize your results.
Right, so we've had some, quite a few clients that's done the exosomes and those types of things, and it was remarkable, the quick turnaround for them.
Correct. About 3 days, and they're back to work. So you can come in easily, do it on a Friday, and return back to work on Monday.
So we did a post with one of our estheticians, our medical estheticians, Carrie, and you can see it in our on our Facebook page. She did do the CO2 and with a pretty deep level, and she did the exosomes. And then a couple of years prior to that, she did a CO2 without any. And on her second day, it seemed like, and we did a side-by-side slide, on her second and third day, it looked like her fifth and seventh day from that previous one. So it is really a game changer for people that are like, oh, I don't want to have all that downtime, or I don't want to walk around looking all crazy or anything like that. So there is options for anybody that doesn't want to have that kind of downtime, but have that quicker healing time.
Correct.
Who would be a good candidate for something like a CO2?
I mean, patients as early as their 30s to, build collagen, prevent fine lines and wrinkles, because you begin losing all of that as we age.
Right.
So 30 and all the way up.
It pairs great with the Profound too. So your Profound goes in and accelerates everything under the skin. And then as early as 2 weeks after a Profound, you can pop a CO2 and add exosomes to have.
Wonderful.
I mean, your Profound alone gives you 60 to 70%, and then you add what the CO2 can do on top of that. And that's no knife, and people love that it's no knife.
Right.
They would rather try something else.
Well, I
so.
know everybody, it seems like that is, they come in and they're like, oh, I don't want a facelift. I don't want to not look like me. I don't want to look altered. I just want to look refreshed and younger, but I don't necessarily not want to, because there is that risk with doing a facial surgery like that. And so I know that seems to be a lot of concern when they're like, hey, I'm going to try this and see if it works. But it seems like most of the people that have it done are pretty excited about the results that they're having.
Yeah,
with it.
absolutely.
And they also don't want to scare family members and husbands for that downtime.
Right.
Or kids.
Or when they have it done, they're like, I'm going to do it over Thanksgiving break or over Christmas break. And they're like, oh, Lord, that's why you need the exosomes.
Yes.
Get that done, and then you're going to just look like you have a little bit of a sunburn, but you can still put some stuff over your face. And I know that we do have post-procedural kits
Correct.
and things like that as well, that helps, with that skincare part of it afterwards, to really help reduce some of that as well. So how would somebody just go about would they set up a consultation? How would they know, what are the steps when trying to figure out what something like that is?
They can easily schedule a consultation with one of the nurses or even with Shawna and I, and we can, evaluate their skin and what meds they're on and get everything prescribed if they're needing something to help calm them or if they're needing something for pain before procedure starts. We would then send those over to the pharmacy.
So it's all they don't even have to think about it.
No.
They get the steps and process from beginning to end.
Correct.
Wonderful. How many treatments usually are needed for something like that?
Your CO2, you're going to want to probably do that at least just once a year or every couple of years. But as far as photofacials and things like that, those are going to be maintenance that you're going to want to do a couple of times throughout the fall.
Okay. And then on the Profound, is it the same, or is it?
Profound, Shawna,
That's one. I mean, you can do multiple areas, but you can't even go in and do the same area twice. You have to wait 3 months
Correct.
or something like that. But the thing with Profound is you start seeing the results at 3 months, and then you get your best results at 6 months. So you got to give the Profound a little time to see what it's going to do. I mean, a lot of people who are considering fillers, if you get the Profound, you need to give it time because you may not need the fillers or you may not need as much in certain places once the Profound's doing what it's doing, you know.
So it takes a little bit more time to really just kick in because it's building and
Yes.
regenerating within.
Your collagen, your HA, yeah, all of that stuff.
So somebody that, let's say, they've been loyal Botox or filler clients, and they're like, hey, you know, they would still be a candidate, even
Absolutely.
though they've had these things done. It wouldn't jeopardize treatments they've had done
No.
before. So it's definitely something that they could do.
Correct.
Okay, great. I was going to say, with the laser treatments and stuff, with the micro laser peel, now that one's a little bit, it's still a good treatment. It's still an aggressive treatment. How's that different from the CO2? So if we're thinking in stages, let's say somebody's not ready for a CO2. They're like, hey, I don't know if I'm ready for something like that. Would you say the micro laser peel would be something that they could?
Absolutely. It's going to be deeper because the photofacial is just going to focus kind of on your sunspots that you're getting as you age. It's going to erase those, but the micro laser is going to go a little bit deeper, but not as deep as the CO2.
Or
And
you
you
can
can
pair it
pair
with
it,
a
yeah.
photofacial.
Yeah. And then how often can you do those? You can do those in multiple treatments,
You
correct?
can every 12 weeks, I think it is.
And then you'd say up to have like 3 treatments on that sometimes?
Right.
Depending, I guess, on what their concerns are.
Yes.
Correct.
Okay. Because I know that I have never had the CO2. It's kind of one of those things where I'm like, I'm not ready, or not even not ready, just it is the downtime. We do stuff like this, and we're always out doing things.
Right.
So it's kind of hard to find that timing. But I absolutely get a micro laser pill every year. And so I do know the CO2 is on my radar to do eventually, but it really is, for me, it's timing and just trying to find a good time to do it. But I love the micro laser pill. I think it does a great job. And I've had family do CO2. We've had clients come in and do CO2, and they just look amazing. And that makes me get inspired
Right.
to do. I'm like, man, I really need to make that work. I need to get in there and do that, especially with all the exosomes and everything to speed up that time. So is there anything else that you guys would think to add with, like, what's your favorite combo treatment when it comes to resurfacing like that? And like we've kind of been talking with combos and stuff, what would be something that would be your favorite, like, go-to?
My
with a
favorite
client?
one is the CO2 with, doing the exosomes because you're reducing their downtime to as little as hopefully 3 days, but you're reducing age. You're going back 5-10 years on somebody. They look younger.
Right. And those exosomes are growth factors that we're putting on the skin, so they continue to work in the future. Like, they don't just work for that one time. Like, they
okay.
Right.
continue to work. So it's really worth the extra expense to add those in there.
Right. So with the exosomes, I know that we've talked about a little bit about it with the lasers and the comboing and healing time. Can you just talk a little bit more about exactly what exosomes are and how they help? I mean, I know we kind of touched on it,
Right.
but since we're bringing it up, that people are probably like, what exactly is that? And what does
So
that mean?
your exosomes are going to be growth factors, and they come from actual donors. And the donors are screened. They're from ages 18 to 26 years of age. So they've been through a very rigorous screening process, and they retrieve the exosomes we provide here are from bone marrow.
okay.
So, it's kind of like if you've got somebody who's 60 years old, there's PRP that's been around forever, but that's using their own blood. So it's kind of like a car. If you change the oil in a car, and you put run the oil through, clean it up, put it back in, it's still coming from a car that had 60,000 miles or so. Whereas if
okay.
you have somebody that's younger, you're not going to use a 6-year-old's blood. So with exosomes, that's where they're more, what can you say?
Well, and they're filtered down small enough that viruses and bacteria can't pass through.
Correct.
So there's
Oh, okay.
there's no chance of infecting anyone.
Yeah, so it's not a risk factor.
Right.
So it's clean.
Yes.
Yes.
Very.
And is there any other ways to use the exosomes other than topically?
Yeah, we can actually do injections throughout the face to help with anti-aging. You can use them on spots like eczema to try to clear up that, just kind of injecting it into the area that the actual rash and stuff is, and it'll clear that away. Some other things that we do, we can actually add it to an IV to kind of help the whole system. It'll go in and target areas that it needs to repair.
Oh, that's really cool.
Joints.
That's all
You know,
that.
there's a lot of people that are looking at, knee surgeries and stuff like that, that will try the exosomes first, and sometimes it alleviates their pain enough that they can hold off on surgery.
So exosomes have been used in a treatment in a lot of different other ways of health. And so now there's a way that we could incorporate it into the aesthetic world and use the
Cosmetic,
benefits
yes.
from it in the cosmetic.
Right.
So let's go back to the profound real quick, because I know that we're kind of a little bit, I got us off on a little, let's side rail with exosomes and healing time and all that good stuff. So on the profound, what is a good time of year to do it? Is it seasonal? Is it something kind of like with the CO2? I know we usually try to stay away from it in the summer.
Right,
I mean, does
fall time.
profound really matter on when that could be done, or is it a good time to do it a certain time of year?
You can do it throughout the year because it
Yeah.
treats all the way up to skin type 5. So even patients that are darker skin can actually have profound done.
It's
Oh,
not
that's-
melanin specific, so you can use it on any type skin. And you're going to have the bruising for about
Sure.
a week, but other than that, there's nothing stopping you from doing your daily activities.
So no restrictions there.
No.
So if you did get, let's say, your leg area done, is there any restrictions on, let's say somebody that works out all the time, or they're
Yeah.
hitting Pilates or whatever, is there a restriction on the time for that?
There is. You want to wait 5 to 7 days, and it's more about adding more heat to that area, because if you heat it up more, it's going to cause more bruising and delay healing time and stuff like that. So you'll still get your results, but it's going to take longer.
Got it. Is there any risk factors or anything with the profound at all, or is there any kind
It
of?
is radio frequency, so pacemakers,
Correct.
Anything that you can't put in an MRI, you pretty much can't use with profound.
And I guess that's something that they would cover in that
In the
consultation.
consultation.
So they would know right off the bat if they're a good candidate or not.
Right.
But most people are safe to have it done. Okay. Was there anything else that you guys, with any kind of, since we're on the laser and all of that good stuff, is there any other things?
I don't think so. I think that kind of touches on everything.
I do know that with our laser catalog or portfolio, if you will, we do treat a lot of different areas. We do like LHR, we do face, we do all that. I know we have the mirror dry as well, which helps with the sweating, which we haven't touched on at all. And with the mirror dry, is that kind of like the profound with the, is it like the radio, like how does that work
Yeah,
on?
it works about the same. It's not quite as invasive,
Still radio
but
frequency,
it's still radio frequency. Yeah.
ablating out the sweat glands and things so that there's no more sweat and odor.
So basically, we can help tightening cellulite, help saggy jaws, and we can help you not sweat.
Right.
And we can do the healing time in half the time. with
And make you look
exosomes.
younger.
Yeah, sign us all up, right?
Right.
Well, that was, thank you guys. That was very informative. And I know a lot of people have been asking. And so with this podcast in mind, we were like, we definitely need to touch on all of the lasers and things like that and different ways we can combo and help healing time and everything. So I really appreciate it. And that's it for our episode 7. Thank you guys.